Hey guys, I'm going to give it a minute for people to start coming on. Let me share it to a few people. Just give me a second. All right, you're slowly coming in. Hi Jeff, how are you today? Um, so I've posted some things on veterans the past few days, and over mainly talking about HR 1215 and a letter that I had received from Congressman Westerman. And then today I have posted for you on the evidence on the suicide websites that you can go to, and it'll show you where when you went to their website that you were receiving errors on them. And so I wanted to kind of talk to you about these things. I have just started showing some. Um, Hi, Mark. I'm about to expose some more, so you want to stay on. And hi, Stephanie. And so I posted today about these websites not working. And truthfully, this is like only at the beginning of probably about 600 page documentation I have found where the VA was failing our veterans. And that is why I have been so concerned about HR 1215 that's in the it's passed the House on a federal level, and so a lot of people do not know about HR 1215. I've been traveling the state on issue 1, and I realized that even our military, our veterans, did not know about HR 1215. Okay, sorry about that. We're having bad weather here also, and so there's a couple of things. Was supported by all of your representatives in Arkansas. I'm going to post after this video where you can see everyone that was for it and who was not for HR 1215. But there were 218 Republicans that voted for it, 0 Democrats. There were 19 no's from Republicans. Our veterans were $250,000, and a non-economic. And the reason they're wanting to do that is because a lot is being exposed or starting to come out. And I had one case today where someone asked me about if I knew about the Lejeune case. And I don't know if a lot of you know about this, but it's on the Marine base in North Carolina. And it was where we have our Marines dying from families, their children. We're having a lot of cancers come out of that base, but the water was contaminated from 1915 to the 1980s. Now, HR 1215 is important because that case right now, there's a lot of publicity coming out about this on this, and they've actually hired a law firm. The government did use your taxpayer money, and it'll limit your right to trial by jury, Mark, and so what's happening with the Lejeune base in North Carolina, where the water was contaminated from 1950 to 1983, the government used your taxpayer money to hire a law firm to put all this documentation together. But what has happened is they put it on a website. There's over 15,000 documents, and they did not index it. There's nowhere you can find it. So it's very hard to find this documentation, which is what the government does. That's why it's so hard for you if you're not researching with what is going on. You don't know how to look for it. And so it's like a puzzle piece. And that's why people like me and other people, when we're trying to expose something that's going on with our veterans, our citizens of Arkansas, citizens of America, it's like we're looking for a puzzle piece. And that's why we need your help. When you contact me and you give me information, or you tell me about your medical records missing documentation, that helps us bring people accountable of what is going on. And so HR 1215 is going to, it's to me an anti-accountability bill. When you have military veterans dying because you poisoned their water from 1950 to 1983, you need to be held responsible for that. And we have currently the VA pays only about 25% of their claims. And not at 100%, 25%. And so that's why we have an issue going on here, is where we have veterans who are not getting the care that they need. And you know what happens when we have them dying. And so when they're dying, sorry y'all, I got a puppy that's wanting to come in. And so what is going on is we have, Congressman Westerman, we had all 4 Republicans in the state of Arkansas vote for this horrible bill. And, and then they think it's okay to tell you that they're for veterans in Arkansas. And, but you know what? We're not going to hold anyone accountable, and we're going to place a non-economic of $250,000 on their life. And then you lie about it when you're, announced on it. See the little puppy who thought she needed in. Sorry, guys. And so, what has happened? Your VA claims being processed. Okay, I'm sorry. I'm having connection issues here today, and then you've got all these cases coming in, like the Arizona hospital, where they ran out of tubes for kidney dialysis, and they had to go to a private hospital to borrow things. And we have just case after case after case. I cannot tell you how many cases in Arkansas that we have. And but the problem is, you do not know that your representatives are putting a price tag on your veterans, and they're putting a price tag on our Medicaid programs, and they get by with it because you're not aware, and you keep voting them in. And so just kind of start wanting to bring awareness to this, that HR 1215 limits the non-economic of a veteran. If someone malpractice, they kill your loved one, how much is your loved one worth? There are statements after statements. You need to go read HR 1215. There are on the chair, there are statements after statements of telling you why this is a bad bill. But we have people traveling the state of Arkansas right now who first takes 2 months to respond, and then they try to tell you it's a good thing, because if we are not being sued by attorneys, then guess what? We can put all this money back in. But you know what? You need to be sued, because guess what? You allowed, just on the Lejeune base, you poisoned people from 1950 to 1983. Children died. We got cancer like crazy coming out of that facility. We have HR 1215. What people do not understand about HR 1215, it rejects the state sovereignty. It applies well beyond medical malpractice. It imposes on excessively short statute of limitations, which can really be hard for children, where they won't be able to bring the case. You're welcome, Mark. And it makes it harder for victims to obtain legal representation. And this is just like the case in Lejeune, where they hired, using our money, to bring all this documentation together. And after I get done, I'll put the link to that website where you can try to look at the documentation. But it's 15,000 pages that are not even indexed. And so you cannot find what's going on. And then we have, this HR 1215 is going to provide immunity for healthcare providers. But do we sit there and close the doors for victims and allow hospitals to do whatever they want, like not have procedures, have veterans come in that are suicidal and it takes you 8 weeks to get them in for an appointment? We have a waiting list of over 300, there's over 250,000 veterans on a mental waiting list that have waited for over a year. Brittany, when I get done, I'll post it on here. And And so in Baltimore, to get a mental evaluation, it's over 780 days. So that is what's really going on. We, you know, we tell people that we have this VA choice. Well, let me inform you a little bit about the VA choice. So when you call your congressman and you ask him about why is he supporting HR 1215, because French Hill did, Womack did, um, uh, Bruce Westerman did, and you ask them about HR 1215, you can ask them about, sorry, the dogs are looking at me really funny. Um, why did they support this bill? And then you ask them, they start saying, well, guess what? I gave you 30 other bills. I gave you VA choice. Well, VA Choice is not completely funded. It takes $18 billion to fund that bill. Also, you have to get permission from the VA to go see a doctor that you choose, and you have to be in a certain area. Well, I've had some of my veterans get to use it, they go visit the doctor, and then they get billed for it. And then the VA sues them for that money, and then they turn it over to credit. And I actually had a veteran who almost lost his house because of this, because the VA charged him something that he wasn't supposed to ever be responsible for. They put it on his credit. Then the VA ran his credit over 23 times, which dropped his credit score while he was refinancing a house, and he almost lost his home over it. And this is just one case after another case after another case. And that's why they need HR 1215, because the government has failed the military and they think they can get by with it. They think they can tell you this is about greedy lawyers. This is about greedy lawyers. This doesn't have a damn thing to do with the greedy attorneys. This has to do with politicians who are trying to cover their butts for not taking care of our veterans. That's what this is about. And so I encourage you to call your congressman and tell him do not back up HR 1215. As I said, it has passed the House. And we had 218 Republicans vote yes for it. We had 0 Democrats vote for it. We had 19 no's from Republicans, and we had 191 no's. And, okay, I'm sorry, guys. It's raining, and I guess my Wi-Fi is not liking me today. But I had a Marine tell me, they said that we leave no man behind. And, that's what they're raised, and they serve our country, and that's what they're told. We leave no man behind, but we are leaving them behind. And I'm telling you that this is the responsibility for every U.S. citizen to call their congressman and tell them to not support H.R. 1215. We cannot put a price tag on our veterans. And, you need to start paying attention to them poisoning our troops. Look at their vaccinations. I don't know if you know this, but when our troops get their vaccinations, a lot of times it doesn't get documented in their medical records. There's no proof that they got those shots. And 63% of our active military right now is on an antidepressant. Start looking at how much Pfizer and them is funding our military. It's like, our troops just come in for their guinea pigs, and it's not okay. And if you're going to make them a guinea pig, are you really going to then write a bill saying, well, if you get cancer, and if we don't tell you have cancer, or we don't have the supplies, or we have medical negligence, then we should only have to pay you $250,000 on non-economic charge. That's not okay. And, medical negligence is the third leading cause of death in the United States. There are approximately 440,000 people die of medical negligence in the U.S. 440,000. So how do you think that if we strip, someone's rights to a trial by jury, and that we have a $250,000, a $500,000 price tag, whatever you want to make your price tag, that it's okay. It's not okay. And, it's scary how many people who do not even know about HR 1215 on a federal level, that they have put a price tag on our veterans. And we have to stop it, guys. You're going to have to get involved. You cannot sit there and say, as a politician, that I love the veterans and I'm patriotic and I support them. And you can show a picture of the Arlington Cemetery. You can show a picture of you walking through it. You can show a picture shaking a veteran's hand. But when you go up to Washington and you place a price tag on them and you take a bill that makes people where they don't have to be accountable on providing great health care and the VA only pays 25% of claims, you're not patriotic. You're not for a veteran. I mean, let's just be real here. And so, let's stop the hypocrisy. You are or you're not. And you know what? You got to stop telling the truth. You got to start telling the truth to your constituents because you know what? We deserve that. It shouldn't take me 2 months to get an answer. The people out here that's watching me, the people out in the United States, they need to know what's going on. And I'm telling you guys, y'all going to have to start helping us dig on this puzzle piece because we've got veterans dying. Today, like I said, I've posted just a few of the documentations I have where the suicide website for veterans did not work. There were multiple errors from the DOD to the Department of Army to the Navy to the Coast Guard, every single branch website. When you went to the suicide part of it, one button would work and then you would click on the other button and it wouldn't work. Every single one of them had an error. Is that what we do to our veterans when they're suicidal? We give them websites that do not work. How much money do they spend of our taxpayers' money to make sure these websites work? And they're not. There's just no reason for it. And other day when I was talking to Congress Westerman's group, they said, well, have you given the evidence? And, first of all, I wasn't in the system, and then I was in the system, and then they said, well, what about the evidence? Have you given the evidence? You know what? I gave the evidence to the suicide hotline, to the DOD last year, and nothing got done. Nothing got done here. When they were passing the bill for the suicide hotline in Arkansas, I called every one of them that was sponsoring that bill and explained to them that if we follow the same program that we were already following on a national level, it would not work. To enter the suicide hotline for a veteran, you only have to be 18 years old and not a felon. And also, if you interview people that work there, they'll tell you that if they talk more than 10 minutes to a veteran that's suicidal, they can be fired. That's just unacceptable, and that's why they need HR 1215 because it gets rid of their accountability. And like I said, I just think that our veterans deserve better than this. And people in our Medicare and our Medicaid system, you don't have a right to place a price tag on them. If you do something wrong, that person has the right to trial by jury, which is your Seventh Amendment rights in the U.S. Constitution. And you have the right to have a day in court. You have the right to be heard, and your 12 jurors need to decide what you're worth. What is your non-economic coverage, not the government? And so I really encourage you to realize this is not just a veteran bill. This is actually a bill that's covering Medicaid and Medicare. If they have a medical negligence, it gives immunity to pharmacy companies, to vaccination companies, that you can't sue them. I mean, the money is not just going to be there. It restricts time on children being able to file these claims. Especially, like, think about it. If a child can only file within a couple of years, and then they find out when they were, like, at Lejeune in North Carolina, that they were being poisoned from 1953 to 80, and we're still trying to get the evidence. I mean, that's why we have to have attorneys. That's why we have to have people that research and try to expose the corruption going on. And why are they poisoning our troops? And why do they think it's okay to put a price tag? It's just not okay. And so, guys, I really need you to call your congressman and tell him that it is not okay for him to support HR 1215. I really need you to start sharing the information on the suicide hotline. I'm going to be releasing things every day. And again, this is not a Republican thing. This is not a Democratic thing. This is about what is right. The last time I checked, when someone served my country, they weren't labeled as a Republican on that field. They're not labeled as a Democrat in that jet. They're labeled as a veteran, and that's what this is about. So, guys, you're gonna have to get involved and help us on this one. So I'm gonna be posting links.